Good afternoon, everyone. Welcome to this webinar. My name is Dr. Khalid. I'm a GP at First Care Practice, and today I've been joined with my colleague, Shabnam, who is a physician associate. We will be carrying out a webinar by talking to you about COPD, its management, and the need for the rescue pack. By now, most of you would have issued a rescue pack by your GP or a COPD nurse, and many of you may be unsure as to when the rescue pack is needed. Hopefully, by the end of this session, you will have a better understanding on the use of the rescue pack. We'll start by Shabnam first talking about the COPD and its management, and then I'll talk about what to do when the symptoms gets worse. Also, please feel free to put your questions at the bottom of the chat box, and we'll start now. Shabnam, over to you.
Thank you, Dr. Khalid. So I'm going to start off with a brief description on what is COPD. COPD stands for chronic obstructive pulmonary disease. So this is a long-lasting lung disease where the small air sacs in the lungs are damaged due to build-up of mucus and loss of elasticity. So this means that air cannot flow in and out of the lungs as smoothly as normal. So what are the risk factors for COPD? The biggest cause of COPD is smoking, as this causes direct damage to the lungs. Most people are at least 40 years old and have some sort of history with smoking or occupational exposure. So occupational exposure includes chemical exposure, fumes, or pollution. In addition to this, risk is also greater if you have asthma and smoke. So you can actually have asthma and COPD at the same time. And a very small percentage of patients have a genetic tendency to getting COPD. The common symptoms of COPD include chronic cough, you could have some wheezing as well, and some shortness of breath. And due to these symptoms, patients tend to feel very fatigued and tired. And normally, it's diagnosed with a breathing test called spirometry. So the normal treatment of COPD consists of two different groups. The first is bronchodilator, which is the reliever inhaler. So this works immediately to relax the muscles in the airways and widen them and allow you to breathe easier. In addition to this, you can have some steroids added to your management plan. So in an inhaler, it's called the preventer, and this works to reduce the inflammation and mucus in your airways, allowing you to breathe easier. And sometimes you can be given it in a pill form when you have exacerbation for a short period of time to help breathing. So although COPD has no cure, there are a few things that you can do to help slow disease progression and increase the quality of life. The first and most important thing is to quit smoking. And you should also get your recommended vaccines. So these include yearly flu vaccines, pneumococcal, and the whooping cough. You should also be very compliant with your medications and inhalers and take them as you've been instructed by your GP or COPD nurse. And finally, it's very important to maintain a healthy lifestyle and eat a balanced diet. Now I will pass on to Dr. Khalid, who will go on to discuss what an exacerbation of COPD is.
Thank you, Shabnam. That was very useful information. Now I'll talk about the exacerbation of COPD. What do you mean by exacerbation? Exacerbation basically means worsening of the symptoms of COPD. Now, I think one of the most important things to mention is what are the risk factors or what can cause an exacerbation. Having an underlying bacterial or a viral infection like a chest infection or a flu can make your symptoms of COPD worse. Smoking, despite having the COPD diagnosis, would put you at a higher risk of having exacerbation of COPD. Other risk factors include air pollution or exposure to chemicals or dust particles. Okay, so what are the early signs and symptoms of an acute exacerbation? If your cough is getting more than usual, that would be one of the symptoms. If you're getting short of breath, which is worse than what your usual or in your daily routine is. If your breathing is getting shallow or rapid, again, more than what's normal for you. If you have a fever, that is an indication that you have an infection line. If there is an increase in the amount of mucus you're producing. Again, also the change in the color of your mucus to either green, yellow, or bloody shows that there is an underlying chest infection. Okay, so that's when your rescue pack comes in handy. So what can a rescue pack do? Basically, the national guidelines recommends that a COPD rescue pack is part of a self-management plan, and it enables patients to manage a deterioration in their symptoms promptly, and hence that can reduce the risk of hospital admission. So the sooner that you recognize your symptoms and the fact that you can commence the rescue pack, it can indeed help with the prevention of or with you going to the hospital. Okay, so the rescue pack includes a steroid tablets, usually given for 5 days, and that would help you to breathe easily by reducing the inflammation in the airways. Also, an antibiotic, which will help treat the infection. Alongside, you need to continue with the normal inhalers that you've got. Next slide, please. We strongly advise that once you have finished the rescue pack and there is an improvement in your symptoms, you make a follow-up appointment with your GP or a COPD nurse in order to reassess your condition and to see if there is a need for the alteration in your medication regime or in your inhalers. However, if your symptoms are not getting better or if they are deteriorating, we advise to seek medical attention ASAP. That is the end of the webinar. At the end, I would just like to emphasize that please make sure that you are compliant with your inhalers. You're reducing the risk factors by making sure you're not smoking, getting your flu vaccination on time, and maintaining a healthy, balanced lifestyle. Thank you. Any questions, please? Shabnam, if you would like to do a little poll, kindly, we would like you to do a little feedback poll for us. We should have actually done that earlier, but if you can just answer the question and let us know if you find this webinar useful, please.
Sorry, Dr. Khalid, just before we do the poll, we have a few questions.
Okay.
So the question is, do I have to take medication if I have COPD?
Which you need to continue taking all your inhalers regularly. The one that has been issued from your GP. So if that's the question, yes.
The next question is, am I at more risk from COVID-19 if I have COPD?
Yes, you are. The answer to that question is yes, you are at more risk of developing symptoms of COVID-19 just because your immunity is low and also your lungs have been damaged by the use of either smoking or different exposure to chemicals. So that puts you at a higher risk of developing symptoms of COVID-19.
Thank you. And finally, should I be using a spacer with the medication?
The spacer can be used with your inhalers. I would advise that you get in touch with the asthma nurse, or if your asthma nurse have not, or your COPD nurse have not shown have not done a proper inhaler technique, then you need to get in touch with them. Having said that, if you've been shown, if your inhaler technique is been discussed with the nurse, then I think using a spacer, it all depends how good your technique is and whether there is a need for the use of a spacer.
Thank you, Dr. Khalid. Are there any more questions? You can just type them in the question and answer section. Just give a minute and then if we can move on to the poll. Okay, I'll just bring up the poll. So if you can give us some feedback on how this session went, we would be really grateful. Thank you. So it looks like 80% of you found this presentation useful. So I hope that we have given you information, and now that you have clarity on when to use your rescue packs. Thank you.
Thank you, everyone. Thank you.